Hi, everyone. My name is Emily Hosford, and I'm an occupational therapy doctoral capstone student. This series is Autism and Feeding Challenges, and specifically this presentation will look at mealtime tips to help autistic children with feeding. So the objectives of this presentation are to understand why autistic children might engage in challenging mealtime behaviors and to identify strategies that can create safe environments for an autistic child during mealtimes. So some of the common challenging behaviors at mealtimes include crying, tantrums and meltdowns, swiping foods off tables, food refusal, leaving the table or having difficulty coming to the table. And it's important to remember that these behaviors are communication that they are not ready to eat what's presented. So this picture here on the left is a bowl of grasshoppers. So imagine if someone gave you this bowl of grasshoppers and you weren't ready to eat it. You have the means of communicating, I don't want to eat that, right? But a child with autism, no matter the level of communication, may not have learned those appropriate skills yet to communicate that they don't want to eat. So in this scenario, if you don't feel safe, you're able to communicate that. If your child does not feel safe eating, they're communicating in the best way that they want to, or in a way that works for them. So the goal of feeding strategies should focus on finding strategies that help them feel safe in their bodies during meal times. And it should focus on exploring what foods work for the child so that they feel confident in feeding and make it a lifelong skill. It is not to have them eat everything that is presented to them. I want to reiterate that that is not the goal of these feeding strategies. So the first strategy is to reduce the pressure at meal times. So be patient. It takes a long time. It takes longer for kids with autism. So your child may need multiple introductions to the new food before they even feel safe to try it. So be patient, offer it more than just one time, but also respect their no. Don't try to punish, bribe, or trick them into trying new foods. Remember, the goal is to have lifelong healthy eating habits. And if we're tricking and punishing and bribing children into eating foods, that's not going to build trust and safety in feeding. Remember that everybody has their own preferences, even you and I. So if your child may not want to eat something after multiple exposures, that's probably because they have their own preferences too. And one way to reduce pressure at meal times is to make it fun, play with food, silly faces with food. Reducing that pressure goes a long way. So, another tip is the division of responsibility. This is developed by Ellen Sater, and she breaks down the responsibilities of feeding into two different roles. So the parent has a different responsibility and the child has a different responsibility. It is the parent's responsibility to decide what, when, and where food is offered. It is the child's responsibility to decide if they will eat, how much, in the pace that they will eat at. So parents, it's not your responsibility to tell your kids how much to eat, to decide if they will eat it. However, we can provide these strategies are designed to help promote if they will eat and help promote how much. But we're not forcing them to eat a certain amount. And as a parent's responsibility, we could just try by deciding what, when, and where foods are offered. The next tip is to use neutral language with food. So using objective language that describes food. So the picture here on the left is the top of a donut, and the objective way to describe that is, oh, those sprinkles look crunchy. That's pink. Oh, it's a very colorful food. So we're not using yucky or yummy to describe them. We're using very objective language and only speaking in facts. Another way to use language is to use can-do language. So you can smell your cheese, or you could cut it with your fork instead. So thinking of what they can do versus of what they can't do, providing opportunities to engage with food with that can-do language. And then using language that promotes choices. So do you want the big cheese, or do you want the big piece or the little piece? That helps them give autonomy and choice in what they're eating, and it can be a helpful strategy to give them choices. For autistic children, routines can be very beneficial. So creating a set mealtime and snack schedule that offers food every 2 to 3 hours. So this reminds them that that there's always going to be food available. If they don't want to eat, there'll be food available in 2 to 3 hours. So creating a mealtime routine. Limit meals to 30 minutes or less. Try to eat in consistent location, whether that's a dinner table or their own separate side table. Finding something that works for them and keeping it consistent. During these meal times, offer enough preferred food to fill them up, knowing that they won't be hungry. You could offer smaller portions of foods that they're still willing, or that they're still learning to explore, but make sure you're always offering enough preferred food. Any food is better than no food. We recommend offering foods outside of their packaging so they don't get stuck in a routine in rigid, repetitive behavior based off of the packaging. And then use adults to model exploration. So thinking of touching, smelling, kissing, licking, what are ways that we can use ourselves as adults as tools to help them learn and feel safe at meal times. Transitions can be hard for a child with autism. We recommend using visual schedules or allowing them to bring a transition object to the table. If it becomes a distraction, just have them park it on the side if they're able. And then with transitions, try to schedule meals after an activity that's not highly preferred. If your child really likes TV and does not like going to mealtime, so it's going to be hard to try to get them to go from watching TV to sit at the table. So if you're able, can you schedule a meal after something that's not highly preferred? One question that we get a lot or in concern is, should my child have a screen at meals? That is up to you and your family and the way that screens are being used. So it's important to ask yourself, is your child using a screen to check out or avoid participating in eating? Does a screen help your child come to the table and help with transitions? Are meal times more peaceful for you with or without screens? So it really is dependent on your family and how you're using it. If you find that it is beneficial and that the screens aren't making it harder for meal times and they're not checking out and avoiding participating, here are some tips to do. So make the screen at meals only available when your child is eating. You could pause it if they seem to get too distracted. Still limit the time to less than 30 minutes. And then prop the screen up so it's not flat on the table. And this is to promote good posture and good positioning during eating. We recommend creating opportunities to learn. So if we're not providing opportunities to learn, then it's going to be harder to try new foods. So we always recommend playing with food. Don't be afraid to get messy. Playing with food helps them tune into the sensory properties and get more familiar with that. Another thing could be offer a learning plate, and a learning plate is just a side plate that's separate from the plate that their preferred foods are on, and it's just there at the table. Encourage that exploration, but there's no pressure to eat what's on the learning plate. They're truly just learning, and it takes many exposures for a child before they may feel safe to even eat it. So thinking of touching, smelling, kissing, licking, all of those, but that come before eating. We recommend giving food-related chores that are age-appropriate, setting the table, cleaning up. This also provides exposures to food. A good one could be serving people, serving themselves, deciding how much they want on their plate. And then creating a safe environment too. If they are wanting to try new foods, allow them to spit them out in providing safe ways. And that if they do try something and they don't like it, they feel safe that they do not have to finish it. Here are some resources. This book, Food Play Every Day, is just ways to play with food and find more exposures to food. And then this is a good podcast on creating gentler approaches that aren't forcing kids to eat, and I recommend them. There's also other resources in the other videos too. And here are some children's books about food. So books can be helpful for exposures. Here's a list of different ones that are about food and are pretty food neutral, and then references. Thanks for watching this series. I hope that you've learned more about autism and feeding and have ideas of strategies and tips that may be helpful for you and your family. Thanks for watching.